okay, this year, are you going to stop smoking? Are you going to try to stop smoking? I'm like, not this year, maybe next year.
Smoking and your heart. We talk a lot about the damage to your lungs every time you light up, and there's also a big link between smoking and heart disease. Today on All Things Heart, we dive into that along with the generational struggle of tackling this addiction. And we're sharing resources on how you or your loved ones can quit.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Today we're showing you what smoking does to your heart every time you light up. And our experts will also discuss the risks of secondhand smoke. The numbers themselves are staggering. The most recent estimates from the CDC show 11% of adults in America smoke. That's more than 28 million, and that's just people over 18. Right now, more than 16 million Americans have a smoking-related disease, and many of those people have never smoked a cigarette. They're sick because of the people around them who are smoking or were smokers. While the number of smokers has gone down over the years, kids are still picking up the habit as well. The CDC says every day, around 2,000 people under the age of 18 will smoke their first cigarette. Here's the good news. No matter how long you've been smoking, quitting will improve your health. It's that simple, but giving it up can be very difficult. Research shows tobacco habits can also be generational, meaning your first exposure was from someone you lived with or you live with now. In fact, a study by the National Institutes of Health found 81% of smokers have a family history of tobacco use. As Janine Kiesling shows us, generational addiction can be tough to break.
Tiffany McCurdy loves her morning routine.
You know, just get up in the morning, have a cup of coffee, and go have a cigarette. Those two things are so intertwined for me.
It's what she enjoys, and she has no plans to change things anytime soon.
I like to smoke. I just like it.
At age 53, Tiffany refuses to apologize for her habit.
I don't want to stop. That sounds terrible, I know. But yeah, I'm of course aware of the health ramifications of that.
Tiffany smoked casually in high school, but the habit kicked in full gear when she went to college at Pittsburgh State University.
I had a 2-hour drive down there and had my own apartment and I smoke all I wanted. I lived by myself. I wasn't bothering anybody else. So yeah, I could smoke inside and that was great.
Like most smokers, Tiffany has quit before, 3 times to be specific.
I'd find out I was pregnant, quit, never think about it. Didn't bother me not to smoke. Didn't bother me to be around people that smoked. As soon as I had the kid, I'd start smoking again. Every time, 3 times.
Tiffany says she is not a stress smoker and can go all day at work without a cigarette. She works as a paraeducator with special needs students. For her students and children, she practices the adage of do as I say, not as I do.
I've spent a lot of time in their growing up years telling them, don't ever pick this habit up. It will be impossible to kick. I mean, because I just don't ever want them to smoke, you know, but you pick it up, it's a hard one to quit.
Tiffany's doctor asks her every year to stop smoking, and every year she says,
I hope I quit one day, yeah. I hope it's one of those things where I wake up and just say, okay, I'm just done with this.
We want to welcome Tiffany McCurdy on today's program to share her personal journey with us. And if Tiffany looks a little bit familiar to you, it might be because of a family resemblance, because Tiffany is my good friend and colleague Jessica Lovell's sister. So there they are. That's how Tiffany wound up on our program. And we know Jess has been trying to get you to quit for years. Tiffany, you're a very good sport and very brave to come on this program. I know it's not a fun topic to talk about, so thank you for joining us. We are also joined by cardiologist Dr. Shannon Hoos-Thompson, and we're joined by nurse practitioner Stephanie Oxendale with lung cancer screening and thoracic surgery with the KU Lung Cancer Navigating Program, and Dr. Kim Richter. Dr. Richter is the clinical director of the organization You Can Quit. I want to start with Stephanie first, just to get a little more of the backstory. Stephanie, you started smoking at 14. Can you tell us how you got those first, or rather, Tiffany, you started smoking at 14. Sorry, you didn't start smoking at 14. I was like, wow. There's a lot of names ending in Y here. Yeah. You're now in your 50s, so you've been smoking almost your entire life. How did you first pick up the habit? Where did you get your first cigarette, Tiffany?
Well, just probably a high school party or something like that. I mean, it wasn't really full time, like I said, till college, but yeah, I mean, it was, weekend parties, whatever. And a lot of kids did that.
And have you been diagnosed or experienced any health issues related specifically to the smoking yet?
Thankfully, no, not yet.
Did you notice any changes, any physical changes the 3 times you did quit?
Well, for sure. I mean, yeah, probably more energy, even though I was pregnant. But all things when I was pregnant seemed to improve because you just tend to take much better care of yourself.
Right. And then how soon after your babies were born did you pick up your first cigarette again?
Well, probably within the first week or so.
Okay. So it was pretty quick. I want to know, are you comfortable talking about family ties or who in your family has been a smoker?
Oh yeah, for sure. When I was little, my mom smoked. My grandma smoked. Everybody smoked. Mom quit a long, long time ago, and but yeah, so that's.
Now you're kind of the last
Mom,
one.
If you're watching, it's not your fault that I smoke.
When you were we're roughly the same age, right? And I remember when I was 14, there wasn't the same information out there, and it was a lot of the cool kids had cigarettes in their hands at parties, right? So it happens, and then fast forward, 40 years later, and it's a whole different ball game. You've said it's a choice to smoke, and you're able to quit whenever you want. On the other hand, you tell your students and your own kids don't ever pick up the habit because it's impossible to kick. That's such a balancing act. Can you explain to someone watching what that's like for you? Because
everybody knows it's bad for you, and especially me. I know it's bad for me. You feel like a hypocrite saying to your kids, hey, don't ever pick this up, don't do this, but then they see you smoking, and that it is. It's really kind of hard to explain. It's just an addiction that I can't quit right now.
I really think any parent can understand the adage, do as I say, not as I do, or as I did. There are plenty of parents. I venture to think there aren't any parents out there who would tell their kids to do what they did in high school, right?
Oh my gosh.
We all don't want our children to follow our lead of the things we did when we were teenagers. I want to get to Dr. Richter, and I want to get to Stephanie in a moment. I want to bring in Dr. Hoos-Thompson, who's our cardiologist, to dive into the heart connection. Dr. Hoos-Thompson, can you talk a little bit about, we talk a lot about lung damage. What kind of cardiovascular and heart damage do you see in long-term smokers?
Yeah, good morning, Alexis. Lots is the answer. So I think the obvious thing is it's low oxygen and it's toxins that we're taking in directly to our lungs. And we know that you don't even have to do it yourself, that other people can be smoking and you can be impacted. So I think the effect of the heart and the lungs working together, that translates into poor oxygenated blood, which, oh, by the way, the heart is a vascular organ. It requires a lot of blood itself. And so the heart and the vessels of the heart are very much affected. And so we see a lot of damage within the circulation to the blood vessels that then feed the heart, and then the heart has to feed the body. And guess what? When you smoke, that's accelerated and very unstable. And you have a lot of problems, not just with heart attacks and vascular problems in your legs and other areas of your body, but also in the vessels themselves of the heart, where they get underperfused and develop arrhythmias and really dangerous and scary things.
We've talked about, when we've chatted about this topic before this program, the thickening of the blood vessels, it raises triglycerides, damages the lining of your arteries. How long does it take for a heart to fully recover when someone stops smoking? Does it ever fully recover?
You know, that's a moving target depending on the individual and other things going on, because there's a lot of dynamics there. But I would tell you the impact is immediate. When you stop smoking, the effects, even within a few days, say you're going into a surgery and you stop smoking for a week prior to having that surgery, you know, people do better just from that short window. So when you talk about I transiently quit for my pregnancy or because of a job change or other dynamics, that counts towards better health. But when you go back to it, obviously that impact of the cigarettes comes back on board with it. So it matters every cigarette you don't smoke, but ultimately quitting, we know it has reversible and stabilizing effects.
We want to show our viewers an image. It's a side-by-side images of a healthy heart and a smoker's heart. The smoker's heart is on the right-hand side. Dr. Hoost-Thompson, why does the smoker's heart look blackened or charred?
It's damaged. It's an injured heart. So that's chronic poor perfusion. That's chronic toxic effects. You see these upper areas of the heart, these kind of flappy things on the top there. Those are the atria, so people are a lot more prone to arrhythmias when you smoke. And again, it's not a constant insult, it is, but there's also a variability to it. And that just makes the heart more irritable, both on the rhythm front as well as the circulation front. And the heart itself is chronically under receiving oxygen and other vital things, and the exchange is not normal. And the heart has impacts to take care of itself, let alone the rest of the body.
I want to bring Stephanie Oxendale in now, because Stephanie, you know firsthand from your medical expertise that smoking affects so many other parts of the body. When it comes to the lungs, is it true that smoking is the #1 risk for lung cancer?
It is. About 80 to 85% of our patients that develop a lung cancer have smoked before. So unfortunately, it is the #1.
So that's it. Does your risk of lung cancer drop immediately if you quit smoking?
Not immediately, but we do see the effects. At about 10 to 15 years, your risk of developing a lung cancer decreases by about 50%. So there is promise. It does, yeah.
Yeah,
yes.
That's huge. You also shared with us some images of damaged lungs, which are so interesting. Can you talk us through this image of a patient that has severe coronary artery disease?
Yeah, so this is a patient that was screened for lung cancer, and you can see in the center where the white structure is, that's the heart, and then you'll see some bright white in that structure, and that's actually coronary artery calcification that was seen on a patient. So this is severe coronary artery calcification in a patient that has a heavy smoking history.
And then you have another image that shows a calcium score scan.
Yeah, so this is another picture. That center image is the heart, and you'll see no bright white there, so there's no heavy calcification.
Okay, and we focus a lot on the lungs, but a calcium score is something that you do on the heart, so how does that connect with what we see on the lungs?
So I'm not quite following your question, so I apologize.
No, I'm probably not making sense if you're not understanding it. How does the heart, what we're seeing there, and the damage to the lungs, are they directly intertwined, or are they two separate things that are affected by the smoking?
No, they're definitely intertwined. Like Dr. Hoost-Thompson stated, the damage from the smoking affects the lungs and also affects the heart. So you're seeing damage to both structures.
And finally, we have an image of lesions.
Yeah.
Wow. So are all those white things lesions on the lungs?
Good question. So this is something that we point out when patients have a lung screening. So you'll see the little dots within the lung tissue itself. Those are actually blood vessels and airways.
Okay.
So the larger area in actually the right portion of the lung, which is kind of backwards on your screen, because that's how imaging works, is a little bit backwards when we're looking at things, but this is a concerning lesion for a lung cancer.
So when we're looking at it, the white blob on the left-hand side is a lesion. Is that like just a sore on the lung?
That is a concerning area for a lung cancer. So it's a developing damage area where a tumor is growing.
So now I want to get to our lung cancer screening program. The University of Kansas Cancer Center has a lung cancer screening program. How does that work?
Great question. So patients can either get referred by a primary care doctor, or any of their specialists, or they can also self-refer to our program, which is great. You can just hop on the internet, fill out a brief questionnaire. One of our nursing navigators will contact the patient, review the risk factors, and get you plugged into the lung screening program. You'll meet with a nurse practitioner, talk about the risks and benefits of lung screening and the scan itself, and then have a brief imaging session, which takes like 3 minutes. It's so fast. And within 2 to 3 hours, you get results.
Right.
And those are provided to you by one of the nurse practitioners as well. We talk about all the findings, the lung findings, other structures as well. We look at the heart, we look at the spine, top of the liver, top of your kidneys. Sometimes we even catch thyroid issues too. So it's a great all-inclusive kind of scan that gives you so much information.
Dr. Kim Richter, today is the Great American Smokeout. Now, every step of the way, I've seen Dr. Richter next to me, nodding your head, yes, vehemently agreeing. I want to get to this right off the bat. This is a very personal topic for you, and you're passionate about helping people. Can you explain why you're so passionate?
Well, even more than I talked to you guys about earlier. So both my parents smoked. They started during World War II. They both served. And my dad was able to quit when he was about 50, but my mom never could, and she ended up dying from congestive heart failure, very quick case of it. Nobody, kind of sleeping congestive heart failure, I guess. But then my dad also passed away from COPD, and that's where, basically he did himself so much good by quitting. But eventually, there is some damage to the lungs, and, he kind of hit the wall at 83. But, he did himself and all of us a huge favor by quitting. And then we have a blended family of 4 kids, and all 4 of our kids smoked at some point or another. And I could have killed them.
Right.
It's like, let's just end it right here.
Yeah.
But our 2 older kids have quit off and on. They live in Australia. And our 2 younger kids have both quit smoking. And basically, it was through me being a little bit of a tiger mom and sticking patches on them in the morning and things like that.
Oh, you would do that? You'd
they would be like, "Mom, I don't feel like smoking today," and I was like, "Yeah, you should check your arm."
Oh, wow.
So so I was persistent. I wasn't mean about it or anything, but just sort of kept it in front of them, and they both have managed to quit. So it's quite possible they stopped within 5 years of starting, and I think that's one big thing we can all think about is, hey, lots of people start, but the trick is to try to stop as soon as you can. But as you said earlier, no matter what your age, you do yourself a huge favor, if you're able to quit at any age.
I just want to check in with Tiffany, see how Tiffany is doing right now. Is it weird to see all these medical images and hear people talking about what could be a really sensitive topic?
Absolutely. Yeah, it is. Those are, things you avoid. In a high school where I work, there'll be pictures of, these are healthy lungs. These are smokers' lungs, like, in a biology classroom or something. Just don't look at that.
Right. It's still I want to acknowledge how brave and vulnerable Tiffany is being coming on this program, and we all are so grateful. I know it's not a fun topic to talk about for you. The whole goal of the Great American Smokeout is to empower people. So, Dr. Richter, what tools do you start with to empower people and kind of take back that addiction and have them get control over things? What are the tools they need?
Well, number one, we encourage people to not think of it as all or nothing, or like it's time to quit, but let's just start engaging in treatment, and that could involve just talking to your doctor about what medications are covered for you for quitting smoking, or signing up for some text messaging, and just sort of getting some messages about it every day, or talking to other people about how they quit, and just starting down the path, but not thinking I've got to quit. It's like the difference between jumping off a high dive and, walking in, down some stairs to get into a swimming pool. It's not all or nothing. And the more you engage in treatment, especially with the medications, a lot of people think, I'll quit someday I'll quit when I'm motivated enough. But another way to do it is to start taking the medications, because that affects your motivations, because a lot of what's going on in your brain is, you every few hours sort of enter into a mini withdrawal, and your brain sort of kicks you in the rear one way or another, very subtly, to say it's time to smoke again. If you can take care of that, then all of a sudden your motivation can change. So, how people quit, there's tons of evidence around it, is through medications. And there's a lot of those. I'll talk more about them. And getting some kind of support, and that can be through telephone quit lines or text messaging or support groups, which we run through the Masonic Cancer Alliance, or even talking with somebody who's quit before or quitting with somebody. And then follow-up. So just sort of staying on top of it. And if you can engage some kind of health professional to kind of have your back and check in with you, that can introduce a tiny bit of accountability, and also they can help you change strategies, if something's not working.
What are some of the most popular medications right now? You talked about putting a patch on your kids, which was old school at the time, but is that still the standby?
People love the patch because the nice thing about it is you don't have to think about it. You just put it on and you change it. Most of the patches are for every 24 hours. Some people like to be mindful of their quit attempt, and they like the short-acting medications. But in fact, I really think we need to start thinking about not stepping up in terms of medications, but starting with the most effective medications. And the most effective ones are varenicline, which used to be known as Chantix, and that is the single most effective quit smoking medication.
Is that a pill or a patch?
It's a pill.
Okay.
It's a pill, yeah. And then combination combination nicotine replacement, so patch and lozenge, patch and gum. And those are the two most effective regimens. But a lot of people find that bupropion or Wellbutrin is very helpful in quitting, and it's evidence-based as well. And some people combine that with patch or gum or other nicotine replacements. Yeah.
So Tiffany, is there anything inside you that wants you to try to take the pledge to quit this year as you sit here, or are you still kind of feeling like, no? Let's stop talking about this.
Honestly, I'm still kind of a no, but again, I do hope I quit one day. I want to. I just don't want to right now.
So where do you start with Tiffany? Where would you start, hypothetically, if we were to put you and Tiffany in a room together? Because Jess wants nothing more than her sister, who's like her best friend, to stop smoking, but to still be respectful of Tiffany. Where do you start?
Well, number one, get rid of the Q word. We don't necessarily have to think about quit right now, but how about trying X, Y, or Z? Trying the nicotine patch, which actually helps people. If you start taking the patch when you're smoking, then increases your odds of reducing significantly and quitting within a year. So one can just start by engaging in treatment, which is in fact what I did with my kids. And they found, and that's, so engaging in treatment, and or some people don't like the idea of taking a medication to quit because they feel like the reason that they're smoking is a lack of willpower. So, maybe not taking a medication, but getting some kind of support, calling the quit line, signing up for text messaging, or getting involved with a group, or even if you're engaged in any kind of therapy, psychotherapy, counseling, you can raise it with your counselor and say, hey, I kind of want to put this on the agenda and think about it, and thinking about just sort of getting it straight in your head, your reasons for wanting to stop. So just think about it, easing into it. There's no actual evidence that setting a quit date increases people's likelihood that they're going to quit, because I think it can create a lot of pressure and anxiety. Some people like to do it, and that's great. So that can be a personal choice, but what we know, really works is the medications and support.
Okay, so making it too dramatic might give it more power.
I agree. That's a great way to think about it. Yeah.
We have so many questions from our viewers. We love getting your questions answered, so be sure to send them in to us on YouTube, Facebook, the X platform, and the All Things Heart email. You will find all those links right here on your screen. Let's get straight to some of the questions from our viewers. We have Georgianne who wants to know, can you ask the doctors to address smokers who grew up in the 50s, 60s, and 70s, I'm sorry, non-smokers who grew up in the 50s, 60s, and 70s when people smoked everywhere else, how badly were we exposed to it? So basically, she's asking about secondhand smoke for decades. Stephanie, talk to me about that.
Well, I definitely think there is a risk there, and there is some research getting to address the secondhand smoke and how we can help them in regards to preventative health care as well. And so that's a really good discussion to have with your physician or your primary care doctor to discuss your risk. Should you have some sort of scan to make sure that your lungs look good and those types of things. But I do think that unfortunately we're at risk because we have secondhand smoke exposure.
Dr. Hoos-Thompson, how many patients do you see that are in trouble with their hearts because of secondhand smoke?
Secondhand smoke, that's an interesting question. I'm not sure I have a great number. I know it's something that we keep in mind, especially if it's something within the last 10 to 20 years. Again, over time, when you've been away from the exposure, like again, the rules that were in place in the late 90s, early 2000s, where public smoking was, even smoking in hospitals, basically we took it away. And initially people kind of pushed back, but I would tell you that was a huge move as far as decreasing the risk of cardiovascular disease and lung disease, all of it, as far as the effects we see from secondhand smoke.
Lauren has a great question. Lauren wants to know, this is a top topic right now, if it's better to vape than smoke cigarettes. We keep hearing scary things about vaping. Who wants to go first on the vaping angle?
I'm happy to.
Okay.
Yeah. So it depends on who you are. If you are a smoker and you switch completely to vaping, then it might help you, if you start vaping, like to quit smoking, it might help you stop smoking. What studies have found is that people who use vaping to stop smoking, they tend to continue vaping. Mm-hmm. So then that begs the question of what are the long-term health risks of vaping? And we really don't know. It's such a new thing. So if someone wants to take that route, then they should be thinking about stopping vaping down the road. But if you're a never smoker and you start vaping, then you're definitely increasing your health risk. I mean, there are a number of short-term studies that have looked at markers of health risk related to vaping. And it looks like vaping does affect your lungs, your heart, the way your cardiovascular system in general. And so, if you're a never smoker, you really shouldn't start vaping because you're definitely introducing a lot of risk, short-term risk, and then a lot of unknowns around the long-term risk because we don't know that yet. And we know with smoking, it takes 20, 30 years for the harms, the big harms to accrue, and we don't have that long of a history with vaping to really know what's going to happen.
Jeremy Yenser has a question, and Stephanie, I'll ask you this one. He wants to know, what's usually the experience that triggers someone to want to quit? Is there a common health event where someone comes in and thinks, I got to make a change?
That's a great question. We see that a lot of times with patients that have had a heart attack. That's a huge event where patients want to stop smoking. But yes, that's a great question. But yes, there are a lot of times where significant health events happen where patients then quit.
Logan has a question for Tiffany. Logan wants to know, Tiffany, how you handle the cost or how much the cigarettes cost you a week.
Probably, oh my gosh, they're over $9 a pack now. So probably 50, 60 bucks a week.
Wow.
Yeah, they're super expensive.
Is it frustrating to have to budget for that?
Oh, I don't know that I've ever tried to budget for it. I just
get them.
Yeah, I was going to quit when they were $2 or $3 a pack, and then $5, and now here we are at $10. So, yeah.
How much? This is a question I have when it comes to quitting. How much of smoking is the ritual? Tiffany, you talked about how you love to have your cigarette and your coffee, and you go and sit in your garage, and that's your quiet time. Like, I associate my coffee on the weekends with something really sweet. So if I didn't have something sweet with my coffee, it wouldn't be the same. Is a lot of that, is that the mental component we're talking about, that comfort of holding the cigarette?
Yeah, I think so. A lot of people who smoke will say that they use it to relax or get some me time or deal with stress. And so, number one, there are a lot of people who need me time and have a lot of stress in their lives, and they don't smoke to deal with it. So, one question is, well, how do people who don't smoke deal with stress? And, if one is thinking about reducing or stopping smoking, then you got to think about, well, how am I going to deal with that stress? What am I going to do when I feel like I need some quiet time? So thinking about those kind of substitutions and other things you can introduce, into your life is really important. And that's where, the quit lines actually, they are not, bossy or preachy people. They sort of ask you about, all of these things and what the role is, that it has in your life and how to switch things out. But also the medications are really key. And I think that, you can buy a pack of cigarettes at a time, and it's expensive. It's $9 now in Kansas. But, it used to be when medications were not covered well by insurance, you would have to pay, $150 for a monthly prescription for, varenicline or something like that. But nowadays, people don't realize that most insurance covers quit smoking medications, including the over-the-counter ones.
That's huge.
Yeah, it's huge. So, if you're thinking about, for example, switching to vaping to quit, you're going to have to buy all that stuff. Why not try FDA-approved medications that your insurance will probably cover, first, and before you make that huge investment in something that, with kind of dicey health risks. And also, people who don't have insurance or any kind of coverage can call a quit line and get a month of free medication.
Oh, that's super interesting.
Yeah,
it's really helpful. I want to bring back our whole panel for some final thoughts from all of our guests. Tiffany, I want to start with you. And again, thank you for coming on and sharing your journey with us.
Yeah, you're welcome. Thanks for having me on. I appreciate it.
What would
I knew
be
my
your...
sister would get me at some point, and here.
She got you? She got you good this time.
Yes, she did. Yes, she did.
What would you want viewers to know who are watching you today?
I suppose just to not start, because stopping is so hard. It is so hard. And I've done it, but it had some pretty high motivation for that. I was, going to have kids, and so that wasn't hard. But now I would just hope that people just would never ever pick it up.
Stephanie.
The one thing I wanted to leave with viewers is that lung screening, for those that qualify, is a great service that we offer. If you're between the ages of 50 and 80, a 20-pack year history, call us. We'll get you screened. We'll get things set up. It's a great thing for your health.
Dr. Hughes-Thompson, final thoughts?
Yeah, so addiction is tough. And like Tiffany said, the easiest way not to have an addiction is not to start, but we're all addicted to something. And some of those addictions are worse for us than others, and it's hard to know the impact until it happens. Really work hard on rewarding yourself for every cigarette you don't smoke, and don't beat yourself up when you do smoke. Again, it's a tough battle, and it's a battle even people who quit fight every day, but you have to know it's worth it, and you have to know that it's not going to be perfect, and that's just fine. Take care of yourself. It's easy when you're doing it because you're pregnant, or you're doing it for somebody else, you're on a show or doing whatever it is, like, okay, I'll do it because I'm supposed to. But do it for yourself. Find a way to do it for yourself, and it's okay not to be perfect at it, because that just makes you human and just connects you more to everybody else who's trying to fight those same battles. So everybody have a great holidays. Take care of yourselves, and thanks for having me.
Thank you, Dr. Hughes-Thompson. Don't go anywhere, because we have something for you at the end of today's program. But first, I want to take a minute to acknowledge some health system employees. This is so cool. We're acknowledging and celebrating the 3 employees who referred the most patients to You Can Quit. And Dr. Richter, let's take a look at who these are. We have the first one, a physician champion.
Yes, this is Dr. Deborah Altenhofen. And I think she not only ordered a lot of treatments for patients, but she also mentored her trainees to do that as well. So she was all over the place in our referrals. Yep, nurse champion Donna Stevens.
Number 2, nurse champion Donna. We're doing like the drum roll. Donna Stevens.
Okay.
Here we go.
Okay, Donna is somebody who our tobacco treatment specialists adore. She is incredibly supportive. She's very kind with her patients, but encouraging. And so we were just thrilled to be able to acknowledge that.
And finally, we have our Cancer Center champion, Dr.
John Ashcraft.
Okay.
And he, I just love this picture of him because he was so shy about being acknowledged for his efforts with his patients. But, you know, we're super grateful. And you know, he's a surgeon and he sees this as a huge issue for patients' recovery. And so we were just thrilled to honor him.
Well, next Thursday is Thanksgiving, so we hope everybody has a wonderful Thanksgiving. The brand new episode of the next All Things Heart will be November 30th, so we're going to skip next Thursday. But before we go, Dr. Who's Thompson, we want to honor one more very special person in your life. Tell us who the people in this picture are.
It's my grandma and grandpa, Grammy and Day. Their 50th wedding anniversary, and this Monday, my grandmother will celebrate her 92nd birthday, and she's passed away. Happy birthday, Grammy.
I think the music drowned out your message. That's your Grandma Joan, right?
It is.
92 years young, coming up on Monday.
92. Yeah, I wish I could see her, but love you.
And you're so close with your grandma. Thank you for sharing that. Is Joan watching?
No, but we'll find a way to get it to her.
Get her on Facebook.
She'll see it. Yeah, she's on Facebook.
Well, thank you so much for joining us. And thank you again to Tiffany for sharing your journey with us. We hope you have a wonderful day. We'll see you back here 2 weeks from today on November 30th. Have a great day.
Coming up tomorrow on the Morning Medical Update. People with epilepsy can get help, but some of the best treatment options are reserved for only the most severe cases. I'm Jessica Lovell. On the next Morning Medical Update, we explore a study that's opening the door to brain implants, giving more patients access to life-changing therapy. Friday at 8.